Hello and welcome to Inside Healthcare. In this program, we're going to take a look at the leading cause of injuries and what you can do to prevent them. But first, President Trump just declared the opioids crisis a national public health emergency. We've asked Washington County Sheriff Dan Starry to join us to talk about the opioid situation here in Washington County and Minnesota. So we're very pleased to have you with us. Thank you, Sheriff, for being with us.
Well, thank you for having me.
Before we talk a little bit about the opioids, you, I understand, provide police services to communities and townships that do not have police, and then also you also contract with other communities for services. What are the communities that you provide this service for, and what exactly are the services you provide?
So we provide law enforcement services to 33 communities throughout the county. And I say 33, that's how many there are within the county. But specifically to your question, we provide law enforcement services to 22 of them. And it's probably easier to explain that. So Forest Lake, Stillwater, Oak Park Heights, Bayport, Woodbury, Oakdale, Cottage Grove, and St. Paul Park have their own police departments.
As opposed to the other, yeah.
Yes, and so out of the 22, we provide everything else for the other 22. And it's traditional law enforcement services, so anything that a police department would do, we do as well. So.
And is there much difference between like the counties and the communities or the rural areas as far as what you're providing services for?
No, not necessarily. So the law enforcement services traditionally are traffic enforcement, criminal investigation, those type of services, and that's what we provide throughout the county. But I do think, with the sheriff's office, we can go in and out. We're county-wide. So even those service or the cities and communities that have a police department, we're constantly in and out of those communities as well. Assisting
them perhaps in some investigations and
Absolutely.
Activities. So you and your officers and deputies are at the front lines of the opioids crisis here in Washington County. What are you seeing here?
What we see is what we see nationwide. We are seeing that we do have opioid-related accidental overdoses, and we certainly respond to a lot of calls where people do overdose. However, through interventions, we revive them, or they're transported to the hospitals, and they are medically treated at that point.
You were telling me that you've been in law enforcement for 25 years. During that time, have you seen this situation grow and increase? Obviously, that was probably before we even had some of the opiates, the painkillers that we now have on them that are now available for health care.
Yeah, the statistics are staggering. Nationwide, last year in 2016, we saw over 50,000 overdose deaths. 50,000. That's a lot. That's more than car crashes related deaths or gun homicide related deaths. So 50,000, that's a lot. And even in Washington County, we're averaging about 17 drug overdose related deaths. And so absolutely, we're very concerned. I would say it is a crisis, absolutely.
And you're seeing this affecting people of all walks of life and all ages, is that my understanding?
Absolutely.
Some people might think it's more maybe a younger condition.
Traditionally, that's what the attitude has been, that it's an inner city problem, or maybe it's a younger person's problem, but it's not. What we're seeing, especially in Washington County, that it affects any age, in any social or demographic. It's county-wide, rural versus in the community.
Really, there's no difference in between those, where if they live out in the country or if they live in one of the cities?
There really isn't. And what we're hearing is with the opioids is that you can be addicted from a first use to maybe 3 times of use. That's staggering in itself.
And oftentimes it sounds like a lot of them, they've had an injury or they've had surgery, they've been on painkillers, and that leads to this addiction and further drug usage.
And the opioids, they're certainly, when they first came out, they were for specific purposes, and now they've been prescribed. So we're seeing the Oxycontin and the Vicodin and the Percocet. And so they're very strong painkillers. And so when you take them and you get addicted, a lot of people may not realize that they're addicted, and, especially after the first use.
You were mentioning about you've been involved in some interventions and things like that. 2 years ago, you partnered with Lakeview Hospital and your office. And what exactly was involved with that partnership? How is that helping? How is that treating these situations, these individuals and stuff?
Well, like with anything, you have to have partnerships and good partnerships with that. And the Sheriff's Office has that with Lakeview Hospital. And so we went to them and we collaborated on what we were seeing out on the street and some of these calls that we go to where there is a drug overdose, and what can we do before the ambulance arrives. Instead of just doing CPR, is there something else that we can do? And so we collaborated, and so Lakeview provided all of our deputies with training and also with naloxone. For a lot of people know it as Narcan. And so we have that training. We carry that vial with us in case we do get a call. And so the deputy on the street has it. They can administer it if they see signs of an accidental drug opioid type related call, and they can revive that person.
How is the program going since you started in 2015?
It's going extremely well. So our deputies like it. They feel that they can do something before the ambulance gets there. They can assist that individual. We have used it about 14 times.
Wow.
And so in those 14, it certainly saved a life or two within that. So, and then
That's
we
gotta
also
feel good that you've been able to save lives. Yeah.
And it's something that we also have developed within our jail as well. Since we run the jail, our sergeants in the jail also are prescribed and carry naloxone as well.
And are other counties and the rest of the state also doing similar type programs?
Yeah, I think it's a newer program that's been out there, and I think that everyone's trying to find how to prevent and educate. And just make sure that the public and public safety officials are aware of what's going on. And so I think with our federal partners, our state partners, our local partners, I think we're all trying to find what is the best way to deal with this crisis that's out there.
And you mentioned Narcan. How does that exactly work in helping someone who's in an overdose situation?
Basically it blocks the effects of the opioid that is causing. And so when we arrive on scene and we see that there's signs of potential overdose, we will administrate that right away. It's fairly quickly, it works fairly quickly, and we've seen that person come out of a potential life-threatening situation and come back breathing and talking and asking what's going on. So.
Wow. Besides opiates, what other illegal drugs situation are you seeing in Washington County?
Well, certainly, we with opioids and heroin, but we also, see methamphetamine, and also marijuana, and that's pretty prevalent out in this area as well.
So besides that, you were saying that some of the other cities are also doing similar type programs. What would be your message to families that might be watching this if someone in their family is in this opiates crisis situation or epidemic? What would be your message to them?
First of all, what a difficult decision it is to have to pick up the phone and ask for help. But that's the first thing that they have to do. Dial 911 or find a doctor, their hospital, their clinic to find out what services there are out there. Certainly if it's a life-threatening event, dial 911 and get law enforcement involved. But with that, what I would say is that Washington County, we're very fortunate that we have great partners that we work with, whether it's the Washington County Attorney's Office, the Community Corrections, Community Services, Public Health and Environment. We all collaborate and we all talk and we listen. We have monthly meetings now, and that even includes the judges as well, is how do we go about helping these individuals? Because jail is probably not the best place for them. There are neighbors, there are family members, and they're going to be getting out. If they are put into jail, they are getting out. So how do we collaborate to help them and get them through this addiction?
Where can they go for some help then? What would be a good recommendation?
Certainly what they can do is call 911, call the sheriff's office. We can direct them to that. But Public Health Environment has great information on their website and the Washington County's website, but Community Corrections as well, or Community Services as well. So there's a lot of phone numbers out there on the county's website, but I would say the first thing that they have to do is pick up that phone and ask for help.
Yeah, I bet that's probably the hardest thing to do.
Absolutely.
And then also, I understand Washington County has a way to dispose of unused pills and medications, and how does someone go about doing that?
You know, if that's another, thank you for bringing that up. That's one of those things that we're proud of. We started this several years ago, and it's been very successful. A lot of these addicts, when they're prescribed medications and they can't afford it, or the doctor weans them off of it, they start looking and searching for other pills and other pain killers that are out there. And most of them find that in the medicine cabinets. And so what they end up doing is taking it. So if we can get that stuff out of those medicine cabinets, and so they're not abused, that's what we would like. And certainly it's been very successful. We call it our drug take back. And we have locations at our service centers around the county, so up in Forest Lake, down to Cottage Grove, and in between. And so, you know, we've collected, and this is staggering for me as well, 17.5 tons of medications.
Wow,
unwanted.
That's incredible.
And if we didn't do it, it'd be out there still in the medicine cabinet. So we're very proud of that.
And there's also that environmental thing. A lot of it goes into the water system through the sewers and things like that
Absolutely.
as well. Yeah.
Whether they flush it or they just get rid of it, same thing. So we certainly work, like I said, very closely with Public Health and Environment and make sure that we dispose of it the right way.
And the show is seen by people outside of Washington County as well. So if they're not from Washington County, can they still use the services?
Absolutely. We don't ask. It's you know, it's something that we have the sites. Come and drop it off, and we're okay with that. Again, if we can save someone's life by having someone go in their medicine cabinet and getting rid of that, we're for that.
You know, you're relatively new as the sheriff for Washington County, just a few months into the job. What would be your hope? Like, if we had you back here in 5 years from now, what would be your hope for the county with this opiates crisis, and nationally as well?
Well, I think nationally, what a major undertaking. But I think with the president's declaration, some of the money that is starting to come through. I know Minnesota just approves $16.6 million in grants to really hope that the addicts will go in and get the help that they need. These are victims, and like I said, a lot of them don't even know that they're addicted. And so if we can get treatment centers up and running and making sure that they get the help that they need, that's what the hope is for.
So the hope would be if you come back 5 years from now, we don't have this situation
Well,
anymore.
that would be the ultimate. We know that won't be the case. But if we can continue to help one person at a time and get them the proper help that they need, that's the hope.
Final message for our viewers?
We're here, you know, give us a call if you need help, and that's county in general. So whether it's the sheriff's office, our police partnering agencies, or our partners within the Washington County, please give us a call. We are here to help. So.
All right. Well, pleasure to meet you. So pleased to have you with us, and thank you. It's been an honor to have you here.
Thank you very much.
Yeah,
Thanks
thank
for
you,
having
Sheriff.
me.
Still ahead, the leading cause of injuries for kids and adults 35 and older, some advice on how to prevent them from a local doctor, so stay with us.
So our lives are not the same. We have to struggle every single day, and that's why we're talking about it and being very open, is because we don't want any other family to have to go through this.
Listen.
All it took was someone who would insist that I just try.
Suddenly, everything was turned around because they judge you.
You tell them, I don't need this.
No one is going to understand.
Unless they've been through it, how can they?
Then one day you realize,
You feel so hopeless.
I need help. I need help.
You feel so hopeless.
Then one day you realize,
Unless they've been through it, how can they understand?
I don't need this.
No one's going to judge you.
suddenly everything was turned around because they insist that I just try.
All it took was someone who would just
Listen.
Maybe you can make retirement happen. After all, you made this vacation happen.
Double points with every purchase?
Cleverly merging promotions.
Love it.
Cross-referencing travel sites. And booking all your flights with those...
Vouchers. I got us bumped.
They were like, oh. But now they're like... Aloha. You aced this vacation. Now get the tips you need to get on track at aceyourretirement.org.
Minnesota Department of Health reports that falls are the leading cause of injury for children and for all adults 35 and older. Doctors at the urgency room say on icy mornings in the Twin Cities, about 90% of their patients are those who have fallen on the ice. The medical director with the urgency room, Dr. Carolyn McClain, tells her patients that on icy days they should assume they will fall and prepare for it. We're very pleased to have back with us Dr. McClain. Thank you for being with us.
Yeah, thanks for having me.
So what do you tell your patients? I mean, how can they prepare for a fall?
So I think the classic is it's Sunday morning and people will actually just, okay, I'm just going to step outside to get the newspaper to see if it's safe to go to church. Boom, down. So if you are going outside at all on an icy day, be prepared, wear boots, don't just step outside because it literally can be black ice and you won't see it. And the other thing, so this, Sunday mornings are the time when people are wearing heels, they're going to church, they're dressed up nice, and they slip and fall just getting out of the car.
Oh my, yes,
So,
I think I've heard about that, yeah.
Lots.
So are you seeing, what kinds of injuries are you basically seeing from it?
So most of the time, is wrist fractures and ankle fractures. The real dangerous cases are when somebody's on blood thinners and they fall and hit their head.
Oh yes.
And when you slip and fall on ice, you can fall so quickly that you don't have time to put out your wrists and you hit your head. And you can hit it really hard. Even if you're not on blood thinners, you can get a bleed in your brain or an incredibly bad concussion. But especially if you're on a blood thinner, you want to be seen right away if you hit your head.
I think I read that a lot of your patients they're just saying, well, I drove carefully to work and then I was just going across the parking lot to get to the office and they went right down?
Yeah, so you're in your car, you take one step out, you're reaching for your briefcase or your purse, and then boom. And that is so common. So just assume that the most dangerous time for you is getting out of your car or stepping on a curb where you're stepping up so your balance is a little bit off. So just pay attention, and as much as we like to look nice when we're on our way, wear the boots and then change into your shoes.
So what would be some of those tips that you would give? Like, what would be some common sense things that you, having seen the patients in the urgency room, what would you say to try to prevent some of these falls?
So essentially you should wear really good boots, really good shoes out on ice. And then if you can, walk with a wide base gait. So instead of walking like we normally do with one foot in front of the other, walk with your toes pointed out a little bit.
Oh.
So they say walk like a duck, but your toes are pointed out so that your center of balance is right between your legs instead of going forward. Because then if you slip, you fall to one side or the other and you don't do the flip onto your back.
I would think also too, we see so many people on their phones. I would think that that would throw your balance off.
Or texting.
Or texting.
Yeah, texting while you're walking, yes, absolutely. Not only that, then you don't have your hands. Because you are, we all protect our phones with literally our bodies. So you fall back and your phone's okay, but you're not.
And we're also seeing falls not only on icy walkways and parking lots and streets, but also at the home. I know my mother-in-law, she has slipped at home more than I can remember. So what would be some of the advice that you would give inside the house?
Yeah, so if you have a parent or grandparent that you want to take care of to try to prevent the falls in the house, one of the things you want to do is set up the house so that they're very unlikely to fall. So just simple things like, how high are their cups up? Do they have to reach to get a glass? Do they have to reach to get a plate?
Oh, hadn't even thought about that.
Yeah, or if a lot of houses have a step to go, 2 steps down. What you want to do is, if you're going to go set up your mom's house, you want to put a plant or some sort of cue that, hey, that step is coming, so that they can't unconsciously just walk, oh, and I missed the step, because it's just one step. And the same when your family's coming over to your house for Thanksgiving, if you could put something on your steps to remind them so that they know how high those steps are, because as you get older you can't see as well. So if you have, those pots on your front way so that they can see, oh, okay, there's 2 steps there. Because it's an unfamiliar place for them, and they're much more likely to fall in an unfamiliar place, which is true of your own when they come over for Thanksgiving. Or so just keep in mind, if you can give them cues that steps are coming, they're much less likely to fall.
And it seems like in the bathroom too is a common place where a lot of injuries happen.
It happens so often. 1, because it's slippery, because you just took a shower or a bath. But 2, because getting on and off the toilet for old people is actually really difficult. And it's very common for the paramedic staff to pick people up falling just trying to get on or off the toilet.
Oh, wow.
And so luckily most people have the life alerts, but otherwise people are, which I recommend, otherwise people are stuck in that cold bathroom floor for a long time until someone finds them.
That would be terrible. What about pets? We love them, but they can also, I know personally, my husband had an injury letting the dog out. I know a good friend, she had got an injury letting her dog out. So what about our pets?
And I don't care how old you are, your pet is going to kill you. They love to run up and down the steps while you're running or while you're going up the steps. But I can't tell you how many people are on a dog walk and the dog shoots off after a squirrel right in front of you and you trip on the leash. And all I can say for that is just pay attention. Don't be texting on your phone while you're taking the dog for a walk, because it is actually very dangerous. A lot of injuries happen while you're taking the dog for a walk.
And I know with my friend, hers was so severe, she did have to she went to the hospital, and then she did have surgery. So when should someone go to the urgency room after they've had an injury, whether it's at home, outside, or whatever?
So anything that, if you look at your wrist and you can see a deformity or it hurts incredibly bad, you should absolutely come in. They do, but you know the difference between, I think I can get by with this. Anytime you have any numbness in your fingers afterwards, you could have a nerve injury, even if you don't have a broken bone. And anytime you're on blood thinners, you should come right in, even if you don't feel that bad, because blood thinners can cause bleeding in your brain with very minimal trauma. So you definitely want to be seen then. For an ankle injury, if you can't walk on it, you should come right in. If the next day it hurts just as bad and you're still hobbling around, then you should come in. So if you can't walk on it right off the bat, you need to come in.
Do you find that some patients might be, they see you and they should have seen you like at least a week or so earlier, and they just didn't want to bother you, or they didn't think it was that bad?
Well, I think there's a lot of hope out there that, you know what, it can't be broken. It's not broken, because people know broken bones could mean surgery. It could mean that you're in a cast for a while. It can make it really hard to drive, because say you break your right ankle, you can't drive. So those issues make people go, not going in even if I'm hobbling. One thing that happens at this time of year, though, when the ice comes, is you break your ankle and then you have crutches.
Oh my
That's
gosh.
even more dangerous. So we try to encourage people to use things like walkers or scooters, which people don't like to use, but they're much safer and prevent you from getting more injuries.
I know my mother-in-law has gone to using the walker regardless. Yeah, it's good advice. Final advice for our viewers on how to prevent some of these most common injuries that we see during this time of the year?
So I would hire somebody to put up your Christmas lights. Because when you put up your Christmas lights, it's so icy, and I see so many people fall off a ladder, or the ladder slips, and those are pretty serious injuries. People break both their arms, both their feet. So if you can afford to have somebody else do it, have someone else do it. Otherwise, use every precaution. Have somebody hold the ladder. Don't think, I've done this 10 times. Well, this is the time that you might fall. And it is, even though broken bones heal, they don't heal fast. And that's a lot of time where you can't type, can't drive, can't dress yourself by yourself.
Oh, wow.
It's a big deal.
You forget.
So
when all of a sudden you don't have an arm.
You can't button.
No.
So just be careful, and
if you are injured,
please come to the urgency room.
Yes,
Yeah, absolutely.
You're willing and waiting for them. So thank you, Dr. McClain. Always good to have you with us. So thank you.
Thanks for having me.
We appreciate it. And we appreciate you joining us. Thank you for being with us. And we hope to see you next time on Inside Healthcare. See you then, everyone.